Hey everyone, this is Dr. Luke Peterson, physical therapist with the Knee Replacement Therapist. You are watching the Knee to Know Show. For this episode, I want to share with you seated knee flexion or seated knee bends, or also known as seated heel slides. A really important and great exercise that you can do at home or in the physical therapy clinic to work on your knee flexion or your knee bending range of motion. So what you need is a chair that you can sit in, and you want a chair that doesn't have a space underneath where the legs are. So underneath should be relatively clear. So for example, doing this on a sofa isn't going to be that effective because your leg's going to hit the sofa and you can't bend it underneath your chair. So what you want to do is you're going to sit in the chair, and I always tell people sit up with nice posture because we tend to slouch because we're not focusing on that, we're focusing on the knee, but it's also very important to keep a nice good posture with any exercise. And you want to scoot forward in the chair so at least a third or maybe a little bit more of your thigh is actually off the end of the chair. And this is going to give you enough room so that you can bend the knee back and forth effectively. If you're a little bit taller or for whatever reason, sometimes people will use a rolled up towel or something similar and just stick that right under the knee, and that will help give you a little bit more motion if you need it. Alright, so sitting up at the edge of the chair, nice good posture. You're going to start with the leg that you're working on kind of out in front of you. It doesn't have to be out super straight so your heel's on the ground, but you want it kind of so your foot's flat and kind of out as far as you can with a little bit of a bend on the knee. And then all you're going to do is you're going to slowly slide your foot on the surface. So you want to have a surface that you can slide the foot on. So if you have like a hard surface, wood, kitchen tile, something like that, you want to maybe put where your sock can be the easiest way probably, or you can do it with, you can put a towel under your foot, you can wrap a grocery bag around your foot. If you're on a carpet and it doesn't seem to be sliding very well, sometimes people will use like a glossy magazine, maybe a furniture slider, something of that nature. You can be creative just so that your foot is able to slide on the surface that you're on. And so all you're going to do from this position is just slowly slide the foot back, and as you do, your knee's going to bend and you're going to go back even underneath the chair a little bit. And as you get to a certain point, you can start to let the heel of the foot kind of come up off the surface. That's okay. You're getting further back. But at some point you're going to get to kind of that sticking point where you don't feel like you can go any further, can't bend it back anymore. You can, at this point, use your opposite foot and put just this gentle pressure on kind of the heel, or kind of the shin and ankle to push to bend a little bit more. Another option is, if you have the motion and the flexibility, is you can even try to kind of push your foot a little bit like that. Or if you have something like a strap or a belt or something of that nature, you can wrap it around your foot, and then when you get to that sticking point, just try to pull it, just like pulling it like this back a little bit more. And there's also some ways to kind of make the strap into a pulley. Again, you can use a belt loop, you can use a dog leash, and then putting it underneath the parts of the chair. So then you have something like this, and then when you get to that sticking point, you can provide that extra little pull, and actually you can put it over your shoulder like this. So there's different ways to kind of put something together to give a little bit of that overpressure when you do this. And so what you want to do is, once you finally get to that end range, that most amount of bending, you can give a little overpressure with the foot, with your hands, with the strap, whatever it may be. And when you get to that end point, you want to hold that for about a count of 10 seconds maybe, and then slowly let it slide out. And typically what I like to do is 10 seconds holding, let it come out, and then do maybe 10 repetitions. Sometimes I do more, sometimes I do less. It's all about kind of listening to the individual and their knee and how their knee handles this exercise. Another option is to do what we call low load, long duration, so a prolonged stretch. So getting into that end range and then maybe holding it for anywhere from 3 minutes to 5 minutes to even up to 10 minutes if you feel comfortable and can tolerate it. That's a good one. I like to tell people to do it between commercials. You know, sit at your chair, watch some TV. When a commercial comes, bend it back as far as you can, and then just try to keep that position throughout the commercials and then relax it when the show comes back on. That's one way you can do that as well. Again, it's all about spending time, as much time and as many repetitions in that flexed knee bent position. Don't have to go super intense and crank on it all the way back, but at least enough to give a little bit of that pressure and then holding it for a prolonged time. All right, so that seated knee flexion, a great exercise for your knee bending range of motion and to improve knee bending. Of course, try to incorporate this with all sorts of different exercises like the supine or laying on the back heel slides. The more you incorporate different positions, different exercises, I find the better you are to typically to regain your range of motion a little more efficiently. All right, thank you very much for watching, everyone. This has been the Knee to Know Show, and we'll be back tomorrow with another video.